Hi, this is Dr. Dave at Keystone Pharmacy. A lot of my patients have epilepsy and they need midazolam nasal spray in order to treat an epileptic seizure. A lot of times these nasal spray bottles are white and opaque, and there's a dip tube that runs from the spray mechanism down into the bottle. The problem with somebody who's having an epileptic attack or an epileptic seizure is that they're not sitting upright, so that tube might not dip down into the bottom of the vial. If they're laying down and you need to tip the tube like this to administer it, then the dipstick might be above the fluid level in the bottle, so you might not be able to get the fluid out. The second problem is you don't use these very often, hopefully, and so when medication dries in the tip of that little orifice that creates that spray, it can create a plug, and so you can't use the medication, which is really bad for somebody who needs it right then and there in an emergency situation. So we've come up with a different solution. We have a needle and syringe. We have a vial of liquid. This is simulating midazolam. It's not midazolam because that's a controlled substance, but we have a vial here. And then we have an atomizer. The atomizer is just a little device that you put on the end of the syringe, and it creates a very fine mist. So let me show you how this works. You take this needle and syringe out of the package. You pull the cap off. You pull the pink cap off of the vial of liquid. You put the needle and syringe in there. You pull out the contents of the liquid, which should be about 1 milliliter. Pull it out. Take off the needle. Attach the nasal atomizer that screws right into the lure lock setting. And then you can probably see this as you push it up. You can see how that nasal spray creates a very fine mist. And the mist will coat the nose. And you want to use about half of a milliliter in one nose and one in the other. So let me show you how quickly this would work. Okay, we have our needle and syringe. Cap off. Pull up 1 milliliter. Cap off. Half of a mil in one nostril, half of a mil in the other nostril, and you're done with your therapy. Now, the really cool thing about this too is that it works in any position. Your patient doesn't have to be sitting upright. So pull out 1 mil. And you can see that if your loved one or your patient is laying down, it works just as well either way. Okay, so that's the theory behind the nasal atomizer. I hope you find it useful, and I hope it helps your patient's therapy.